I'll start that over up here. Yes. Are you guys going to talk? We want to listen and hear, and however Senator Abeler moves it from there. Okay? All right. So, Senator Abeler, if you want to say two things, so we pass this around.
I apologize for getting lost in your way.
Want to talk or not? And if not, we'll just pass it around.
I'm going to do it. You think that's I'm on the north side of Twin Cities, and I'm very happy that you come down here. I've been in the legislature for almost 7 years in the House and Senate. In my day job, I'm a chiropractor, and I'm very active in the whole health discussion. I'm very concerned about where things are going, and I know how you are. And so, when you don't know what to do, maybe you take advice from people who understand the problem, and you try to solve it in a collaborative way. That's our style. And otherwise, if you don't know what you're doing, you just keep following ahead, you wind up being 15 minutes late. Actually, but when I was late, I actually called for advice, and then they got me back on track, and I got here. Part of what happened is just has been one side decided it all, and they really didn't take our advice. And so many of you are in harm's way. And so we'd like to, political people like to talk, and I'm really interested, let me tell you. But I'd rather hear from my mom really thinks that. But we'd like to hear from you about what it's like, because we've heard some stories, the more we know, the more we can actually figure out a way to fix it. There's some proposals on the table. At the end, we can kind of review what sort of things are being discussed. But this is right in the middle. This is a big mess, huge mess. And then you've got the renewal notices. And so I'm interested in knowing what it's like down in Owatonna and this region as we put together as there was a meeting with the government staff on Monday for one of his proposals. So this is very much a live topic, and knowing what you are experiencing will help us do that. And maybe along the way some of the others can comment on it, but most of you want to listen. And so many of you can tell your stories for 10 minutes, but if you keep it to 3, I think you can kind of focus your points, maybe what it's like, what are your thoughts going to be, do you still have your network, are you surprised, whatever seems appropriate to your situation. Maybe how big your family is and what the prices might be. That sort of information would help us as we're kind of here fact-finding and listening to you with what's on your mind. Clearly, something's on your mind because you came out with this tonight, and this is a very large group, so thank you for that. Is that clear? And so somebody might be a timekeeper. Anyway, so maybe if you want to talk, maybe you could stand where you're sitting and say your thing, and it'll be like a hearing, but a little more casual. Yeah.
I had a question about it. Is it fair to ask before we get started how many people that came here tonight are actually on MNsure? Is that a fair question?
Okay. Well, let me explain MNsure versus the individual market. MNsure is just a store that sells a product. We spend $400 million on each business. $400 million is what people spend on things. Most people spend the money, which some people think is free, but it still comes from you, a lot of it. And so MNsure sells products, and it sets you up with a tax credit. It's also not free, by the way. It comes from somebody pays it, probably you. And so there are people who buy their products through the exchange, MNsure, and some people who don't. The particular problem that's occurred is called the individual market. And there's 250,000 people that buy their insurance all by themselves. They buy it from Blue Cross or Medica. They buy an individual policy. And I guess I'll just do a little background. It used to be 45% of the market was in the fully insured. You buy it from Blue Cross or Medica, and the state laws control that. And some people bought through their employer, and then there was Medicare and medical assistance. Medical assistance has grown. The self-insured big corporations have grown. And so now the fully insured market is only about 20%. And that 45% shrinking used to chip in money to pay for the people that had the highest cost, that were sick and couldn't get insurance. They called MSHA, different than insurance. And so as the plans assess you $168 million in the last iteration to pay for these high costs. Anyway, so, and the Fed chipped in, and this year they quit chipping in for next year, so that's part of why we fight. Anyway, so 5% of the people now are buying their own policy. 15% buy in a group somewhere, and that's a little more, groups are just kind of random. So the people who have the most health conditions wound up buying individual policies. So that 5% of the market, 250,000 people, absorb 30,000 people who are really quite sick, and their costs are spiking. And it's a design flaw. Many of us said that's a bad idea. Don't do this. Please don't. 17 years. The last 6 years has been, that's bad. But anyway, and so what's happened is all these costs have landed on the individual market. About 40% of those bought their insurance through MNsure. About 60% bought them from their local agent down the road. But the products are similar inside or outside MNsure. And so about 60% are eligible for some kind of subsidy. About 40%, or 100,000 people, are not. Even the people who get the subsidy, the prices are still going up, but more money falls from the sky to subsidize those very high costs. The 100,000 people who are on their own, who don't qualify for subsidy, as you probably know while you're here, are getting their rates increased 50 to 67%, on top of 30% last year. And so that's, and you could even say that you buy your product through MNsure, you did, or you didn't buy it through MNsure as part of your testimony. Is that helpful to my thinking? Yes, that's
Okay, so then we started the list going around, so please sign in if you want to talk. Dave Vandel's on the list. You want to talk, Dave?
Already?
Yes.
That's not fair.
Tell us your name and maybe what town you're from, and then I think you're Dave Vandel.
I'm Dave Vandel from Owatonna, and just to answer the gentleman over there, I am on Medicare. So I am here for my granddaughter. What's going on in this drives me nuts. And you have people that are on the other side of the fence that say the reason this has happened is not Obamacare, it's because of private industry, it's because of the Medicare cost, or drug cost, it's because of greedy doctors, it's because of all this. These people need to be straightened out. They need to know that this is not what's doing it. And they need to, and I'm here tonight to hopefully have you guys explain that. There's a whole lot of other things going on in this world that I don't like for my granddaughter. And that's when she goes to the bathroom, I don't want some pervert going in there that thinks he should be a girl, and doing that. So we could go. And that's why I say this isn't fair, because I've got a whole bunch of other issues.
Yeah, I got it.
But, I've had this discussion the last 4 or 5 mornings at coffee, at work, at wherever. And why do you're a doctor, you're not a politician, why are these costs going up? Why is the insurance rates going up? Why are these companies leaving Minnesota? And my opinion is they want one pay, and I'd just like to have your input on what's the real reason behind this.
Fair enough. Troy, I really came to listen, and I'll talk with my mom likes to talk too. Anyway, how many of you do you think you want to talk to me? Just raise your hand if you want to. I hope a lot of you do. Looks like that's done. So maybe if we could give a short comment, and then I can stay here until you're all done talking. I think until 9 is probably a good target for this. But that's a good thing. Yeah. But we can stay longer. But anyway, so some people think this is a move towards single payer, that people who designed it didn't have good faith. The trend in the industry is just a few percent, 3, 4, 5, 6%. This particular niche is an outlier that just got pounded by all the bad decisions that got made along the way. I'll just say in my opinion. They didn't listen to me. I was trying to give them advice and my experience, and they wouldn't listen. They didn't listen to I took directions to get here. They would still be driving around, they'd be in some cornfield, which is really where we are. We're in some goofy cornfield. We used to have a really amazing health system. And so I'd like to, as you discuss, maybe say what you had and what you have to have now. That'd be helpful. So let's take a minute.
All right, so Deborah Robinson?
Yeah, I'm from Waseca, just recently moved from Worthington. We've been hearing a lot about problems with the Affordable Care Act. I gotta tell you, there are some things that I like about the Affordable Care Act. My husband and I are very grateful for it, and this is why. A year ago this fall, my husband was very busy with his harvest, farmer. He and I noticed that he was having some memory problems. We made an appointment with Mayo Clinic for November, and the doctors there told us that my husband has Lewy body dementia. It's a terminal disease. It's going to take him away from me before he dies. After the diagnosis, I remember many sleepless nights wondering how we were going to manage. Where will the money come from? How was I going to take care of him? I did not have to worry about losing our insurance. I did not have to worry about maximum benefits. Believe me, there was still plenty of things for me to cry over and worry over, but Doug being able to access the care he needs was not among them. Later that winter, I developed a rare form of autoimmune diabetes. This meant costly trips back to Mayo. It also meant that I will have expensive health care needs the rest of my life. Once again, I was grateful that I could not be removed from my insurance. Despite what you may have heard, I remain grateful. You see, I have done a lot of research, and I know the Affordable Care Act and MNsure are not responsible for the rising cost of health insurance. It's not greedy doctors. Doctors are not making a lot of money. It's not greedy hospitals. Hospitals are not making a lot of money. There are other factors, though. And you were right when you talked about that outlier pool. We're talking about people just like Doug and I, self-employed people.
Okay, so you have one more minute to...
Okay, well, I'm going to continue. I'm sorry, I'm going to be real fast. Doug Farms and I own a small business. Our insurance rates always went higher. Plans through every year, even before the Affordable Care Act, our plans were going up and up and up every year. They went down the first year of the Affordable Care Act. Last year they jumped, and next year we expect $33,000 for our insurance premiums, and that will, of course, unaffordable. We have to focus on solutions. I've been talking to representatives and government agents, and as I have said, I've spent many hours in research. There are solutions, lots of them. Some of these solutions have been submitted as legislation but went nowhere in our gridlocked government. I'm here to tell you that that type of gridlock is unacceptable. The time for partisan games is over. I am once again spending sleepless nights worrying over finances. My husband and I worked hard for years to build a retirement that we hope to be filled with travel and leisure. Misfortune has taken that from us. Our hope now is that we can spend a few years building happy memories. That hope is fading away as politicians dither and fight for political gain rather than build solutions.
Okay, so we'll have to cut this off so in light of time for everyone else.
I know, I'm going to just say a tiny bit more. Time is running out for these solutions. There are quick, immediate things that can be done. Proposals have been made by Governor Dayton, Representative Thiessen, Senator Bach, Representative Hamilton. So there's been Republican solutions and Democrat solutions offered. Even former Commissioner Hatch has offered suggestions.
Okay, so
there's no shortage of ideas. We can do it.
All right. Do you want to respond to everyone or just keep listening?
All right, let's think.
Okay.
I'm so sorry about that.
It is awful. And the extra stress. I would not have stress if I believed that we would have a special session and people would talk about it. I'm losing faith in that because people are trying to use this as a political football to gain votes. I find that reprehensible and immoral.
You mentioned Representative Hamilton. He and I co-authored an editorial on October 6th.
Yes, I read it.
Calling for a special session because the issue is how do you handle the tax off vote. But I will tell you, as I'm a very collaborative Republican. If you know me at all, you don't know me.
I I've heard that about you.
When we tried to address this issue in 2013, when it started getting to be passed, I was actually on the conference committee to pick an insurer. I've been part of every discussion, and the discussion was all one way. They were just going to do this. And if you look at my quotes from back then, we warned them. And even just lately, the governor and the commissioners knew about these rate increases. Didn't tell us the cost was leaving. And I think Mr. Hamilton and I have helped force this, to push it to the special session argument that we're there, which means that one member can do a lot. And so I'm being gentle in my comments. I didn't hear to come to bash anybody, but I came here to listen, to work towards solutions. But you have to know that one side blocked us from doing what we want.
And I think that's all that can be said. That can be said both ways. I know it.
Yeah.
Both parties can start talking about who's at fault, and I'm so sick of that conversation. I want to know that there'll be a special session that will rescue Doug and I from catastrophe.
Okay, so next on the list is Alex Turco. Did you want to talk?
Well, as we've heard, we know it's expensive, but you absolutely have to have it in case there is a catastrophic medical issue. My other problem with this is that I have no confidence that I'm making the right choice when I buy my insurance. I used to buy it privately. My agent would tell me I trusted that. Now, I've never used it, but I'm still not sure that I've made the right choice. Is there a way to help us determine exactly what insurance that we need? Is there somebody, I did call the state and I talked to somebody at the state that they didn't have any good answers. I feel like I'm kind of back.
Well, are there any insurance agents in the room? I really have a lot of confidence in the agents. They are much more highly trained than the staff at the insurance.
Yes, but my agents, after they quit selling insurance, wasn't able to really help me with buying other insurance either.
Well, you have a very limited amount of choices.
We do.
When Medica fills out your stuff with,
So are they all good then?
what's that?
Are they all good then?
Some are more. Our rates are higher.
Okay.
You're down,
But I want to make sure that everyone picks that.
I don't know how many choices you even have down here. That's why I was curious if the agents could maybe comment along the way. Yeah, go ahead.
15 in Steele County.
From Blue Plus or from different?
From two insured, Blue Plus and Medica combined for 15 available options. I was just there last Friday.
And so when Medica fills out, how many will be left after that? Medica has three plans.
Three Blue Plus, there's three Blue Plus plans, and then the rest is all Medical.
And how good are the Blue Plus?
Annual premiums range from $32,000 to $45,000 for what would be for our family. The Medica plan annual premiums will range from $26,000 to $37,000.
That's a lot of money.
Family of four, two teenagers with a anywhere from $8,000 to $14,000 deductible on top of those premiums.
Yeah, I'm sick about this. Medica has a cap, and it's a small cap, and they're gonna go with 43,000. They can add 7,000 more people. And so, anyway, I'm trying to be polite because I actually, the governor and I get along real well, and I'm happy with him. And with the commissioner of commerce, with whom I get along real well, that they have let this happen. And I talked to him just yesterday. He said, I worked really hard. I said, okay, that doesn't help me, but I worked really hard. I can't imagine what bad would look like if this is the best we could get. And so, actually, I liked my catch's comments where he was going to press for, but are the caps legal? I don't know that. I'm concerned that that's legitimate. If it's the right price, why don't you sell as many as you can sell? That used to be how it was before. There were no caps. I question, is it a legal answer? I'm disappointed Blue Cross left only to offer you a higher price, inferior product in their other line. And so, I didn't promise to come with all the good news, I wanna know how bad it is, so I can keep talking to you, so. And there's a proposal on the table to give a 25% tax benefit, or some kind of rebate, which I think is a start. That doesn't solve the limited network, doesn't solve, you can't go, you have almost, what clinic, the access to clinics, is there a clinic you can't get to in Blue Cross down here? Or is it, you have access?
We have one.
So you have access to the clinic that you wanna go to?
But not the hospital.
Yeah, so, and so if you fix the money, which is the proposal on the table, that doesn't solve your hospital access, it doesn't solve the price, although the price is a little lower, about a 25% bump instead of 55, that's the net change.
Well, does it help? I mean, you give it 25, where's that other money gonna come from? And how are they gonna make that up?
Well, the proposal is the state would spend $300 million of your money to subsidize the people in this 5%. It's about the people who are.
Yeah.
So it's a
How
band.
does that fix it?
It's a bandage, and it doesn't fix the hospital, it doesn't fix the cap, it doesn't fix the access issue.
So in other words, it's just for proposal.
No, it's the size of time. And a lot of us are very frustrated. The smoke in my head is not coming out my ears. Anyway, let's listen to some more people.
So, Kurt, did you want to add anything else?
Well,
Oh, yeah, I'm sorry.
no problem. No, I just had a list of the plans and some information we put together. You know, for our family of four, obviously some of the increases we've seen over the years are a result of aging, because as you age, your premiums go up. But we're looking at you know, since 2014, a 24, 11, 60, 65% increases.
Yeah.
You know, our annual premium, if we can get the plan we want, we're looking at $26,500 for premium and a $13,000 deductible on top of that.
And how much was it, how much did you?
Last year, our premiums were $16,000 with a $13,000.
Hey, Kurt, and tell them that's not a premium plan either, that's about as low as you can go.
And that's only, last year, the only reason we were able to get by for that is because we switched from Blue Cross to Medica, and in essence, just substituted premiums for deductibles, because if we would have stayed with Blue Cross, we would have been $29,000.
Excuse me, what's the penalty for not buying insurance? A lot less.
A lot
Less than that 49,000.
2.5 or what? 2.5. 2.5% of your API.
But, so it's just, as a small business owner, it becomes, you know, one, it hurts our ability to, it takes that money out of our business so we can pay our health insurance premiums instead of reinvesting in our business or additional employees.
That's a whole additional employee.
It is, and, you know, so we just have to work twice as hard, or twice as many hours, not twice as hard, because we're already working as hard as we can. So we have to work twice as much to replace that employee we would have hired.
Or raise your costs.
Or it raises our costs, which potentially prices us out of the market. And, so it's really, you know, in addition to personal financial difficulties, it's a huge drain on the economy of Minnesota, because most of the people that are on the private plan that aren't getting subsidized, the reason they're buying their own insurance is because they're business owners.
Yeah.
And in most cases, either the husband and wife either have their own business or work together on a business, or you know, or a farming business, or whatever type of business it is. And it's just, it kills the ability for those businesses to grow and prosper, because it drains so much more out of the business, just so the business owner can, you know, keep his family insured.
No, I used the word in my speech and stuff, crushing. So I,
It will destroy.
I came down, I think I should speak. Sorry,
Okay.
thank you.
Next one's Francie Hall. Do you wanna ask a question, Francie?
I'm curious how it is that we got into this predicament in terms of the insurance providers raising the rates so high. And in a letter I just read over here, it's like double the cost, and they give no reason for it whatsoever. So what role do insurance companies play in the cost of these products?
Have they come up with any suggestions?
You know, my 37 years I've been in practice, I've learned not to be that confident. Solutions coming from there. I've tried to do reforms since I've been in office 17 years. Ways to make it actually more economical, have better quality, complete access where you want to go. That's been on my head about what's good for the families and the patients. I'll just tell you what happens with the Department of Commerce, which is one of my bones to pick with the administration, is, and Mike Hatch's editorial was spot on some of that stuff. The job of commerce is to make sure that the rates are, they follow the law. The law is that they can't be actuarially insufficient to make sure that the plans are sound, so that your bill comes and then they have to pay. But they do not have a responsibility in the law to make sure that they're not too high. But if they're too low, they'll bump them up. And
That seems pretty.
now, and I'll just tell you what happened. So Blue Cross, so everybody turned in their rates for this year, and they were 25% off or something, which was a lot. And then Blue Cross announced it was withdrawing from the individual market, this market, leaving 103,000 people with having to shop elsewhere, plus whoever wants to shop anyway. And then the plans refiled, and that we up to 50 to 57%. And I might have asked the question, what happened that you had to double your increase when you just get more customers who are presumably of the same bell curve, maybe they were sicker, I don't know what, but I've been begging for hearings. We have a hearing, we can talk about it, so I can ask you all, why did this happen? You have these fine people here who are about to be run over by their own tractor, and as it were, I mean, actually by someone else's tractor, kind of on purpose. It's just really, so that's the best I can tell you, and the health plans are a business too. They're a non-profit and they're sort of transparent, but not very transparent. And they have people to answer to, and they're sort of not. Yeah, please.
I think the other thing to think about is just remember that when MNsure was first put into place, what did it direct? It directed insurance companies. It didn't really direct anything else. It really then instigated all of the procedures and processes for about how we get insurance. And so we have to also look back at the program itself and what was its dictates, what was its mandates, what were its responsible, and what did it tell the insurance companies that they needed to cover and not needed to cover. It dictated an awful lot about premiums because there was just an automatic assumption that everything was going to go down because all of a sudden you had people on the list. But it really dictated a lot more about what is it that insurance companies have to do and provide and so forth, and how it dealt with those, both with limits on, eliminating limits on caps and the pre-existing condition issues and all that sort of stuff, all got added in, and there was no thought about, okay, this might actually cost me. And so I think that's part of where we're dealing with too, in that I think we need to be looking at all the solutions. I think we talked about it earlier. Everybody that's involved with medical field needs to be part of this plan and part of the solutions that are here. One of the ladies here today, and I won't mention her name unless she wants to bring it up, was a lab technician for a local hospital, and said she would send patients to Mayo Clinic with labs drawn, with IVs put in, and so forth. As soon as they went to Mayo Clinic, first thing they did was rip everything out and redo all the tests. Why? I mean, was there something bad about the other one? But it does create another cost revenue as well.
That happened to me. I had a sick recruiter, and I was at Owatonna from May through August, September, and everything I got done here, they started doing there until I said, wait a minute, stop that. What? why don't you look at what they've done, your Mayo and their Mayo, look at this, you know.
So I mean, it's really hard to point the finger at one place, when I think all of them, all of everybody has to be involved with the solution. And that's kind of what we're here getting from you, because this is a group that we can get information from, and we'll be looking at other places as well.
Are you suggesting that you should remove the caps or, allow them to, deny pre-existing conditions?
No, what I was saying is that during the way the insurance structure was set up before, they had put in place the risk pools and others that they knew and had different rates for insurances. With Mitsure, that all came down to even keel and without the thought of how it was going to impact the cost. I'm not saying it was bad. I'm not saying that. What I'm saying is that when you have $100,000 exposure and a $10,000 exposure, and then you expect premium to be the same, and then it's going to be at the lower price, you're probably kidding yourself. And I think that's
And
what we're
because
doing.
one thing else too, is that, no pre-existing conditions, no lifetime limit. Minnesota already had guaranteed renewables. It's got the same thing, that they couldn't stop you from doing that. And getting ourselves up to 26 is no magic. There's no limit. You can still charge more, at least they have the right to be on your phone. But so what's happened is there's no competition. So you're down practically in this area to Blue Plus. You have one carrier with 3 plans. And so part of our solution, which we warned about, was you need to have more competition. You need more people coming in. There were some decisions made back in the 90s that drove off the Aetnas and the other regular Prudential and other health and e-health. They used to be here in some force. Aetna had a big office in the city. And the HMO phenomenon came, we embraced it wholeheartedly and ran off people who could have provided some competition. Part of what I think is, why don't we, it's actually legal but very hard, why don't we allow all farmers to merge into a plan and take their $26,000? And it doesn't sound better than the insurance companies do. And so why don't we let all the, small businesses join as other small businesses if they want to have their own particular plan and watch how you spend the money. And so that's part of the solution phase, which is beyond now. But this is productive.
Excuse me, Representative, really quick to respond to your competition issue. It's not about insurance companies being able to compete as much as in this part of the country, we have no competition as to the healthcare provider. We live in Mayo land.
Yeah.
And I love Mayo. They've done wonders for my family, and they're the best world-class there is. But how many of you here are in business for yourselves? And you're a chiropractor representative?
Yeah.
Do you have a competitor chiropractor in the town you operate in?
Few of us around there.
You have compete, right?
Yeah.
How about all the other business owners? You guys have competitors? You've got to create a value proposition and you have transparency. Your customers ask you what it costs and what you're getting. We don't have that in healthcare.
Right.
And until you create a system in our state that encourages healthcare providers to come in and compete, bring Sanford in here and build across the street from Mayo and put a sign out front saying physical, $99.99. How many of you have your insurance pay for your utility bill, have insurance pay for your cell phone, have insurance pay for your car payment, a third party? We've had high costs because we're so used to somebody else paying the bill. Until we become consumers and there's a competitive healthcare provider network, we're never going to control these costs.
And I couldn't agree more with you. And that's a little beyond the scope of tonight, but I also want to point out, in this environment with you all in the individual market, if you look at people in a group market, the trend there is only a few percent. From the same exact providers, I mean, it's nothing like this 50 to 67%.
We went up 17 this year on the group.
Yeah.
It's a national group.
Yeah.
A lot out of New Jersey. Last year we went up 13%.
Yeah, and then these groups vary by experience, and so they're all over the map. So, but also to your point, the worst thing that ever happened was going away from a modest deductible in the 80/20. Because then you knew what something, you had to pay 20%. Do you care? Is this a $1,000 thing or a $12,000? $12,000, man. If you have a $6,000 version, because then you had to pay part. But the co-pay, $50 to go to the hospital, why do you care what it costs? You look at the bill, oh, I paid my $50 and it's free, and it's not. So I think at the end we can discuss, I mean, I love to reform health and make it, and make it better for people, that's the whole.
Okay, Mark Cunningham, you want to talk?
Sure, well, basically, I signed up because I was signing up for free stuff.
Okay. What do we can do about that?
No, but,
Cookies are over there.
Because people like free cookies, sure.
That's right.
No, but, as far as for competition, I think that's the best way to get, or to keep prices in line with anything. Why aren't more insurance companies involved? Why aren't more insurance companies in this mid-share thing? Why is it just one or two?
I'm not nearly experienced.
You know,
John and Jim.
we didn't introduce you guys, did you, you all know who you are?
I think it's Brian Daniels, I represent 24B.
Yeah.
And the things that I do know, I'll start with that, is that I know when Venture started, they had certain projections on how many people would sign up under the program. And I don't remember the exact numbers of like hundreds of thousands of people that they projected to sign up, but I remember the percentages. They were off by 84%. So if you're a business owner, and you start up a brand new business with that, whatever it is, $200,000 in your business to get started up, and you're projecting $200,000 of sales a year, but you're off by 84%, guess what? You're not in business very long. And that was part of the reason I think, I'm not even naive, but I think that's one of the major reasons that the costs are going up, because these insurance companies are looking to get, let's say, 400,000 people signed up, and they didn't get near that. I mean, it was so far off that all of a sudden the selection was less, the profits were less. I think that's why some insurance companies said, we can't make it go bigger. There's just not enough numbers to make it work. That's about as much as I know.
Well, you're dead on, and the promise at the time was you keep your doctor, keep your plan, it's gonna be cheaper, it'd be like shopping on Expedia. I was at the press conference, and I was saying, like Expedia. Actually, unless you have like the old Apple IIe with a little screen, when you're trying to buy an airline ticket on that Expedia, maybe that's where you're slow to look at that, but, the venture experience still is not like $400 million for a lousy year. And so we, in 13 and 14, it was the Democratic governor and House and the Senate, and trying to get a loyal minority and trying to help make the same goal. And they were just bent on it. And we said there should be somebody on the insurance board who actually knows the business, somebody who knows insurance, some person who's high technology, they have a company maybe. They said, oh, we can't have conflict. And so they had people there who were not experts at all. And we said, it shouldn't cost 3.5%. That's what they were calling. Oh, it's only going to be like 2. It's going to be like, that's not much. And 3.5%, just as a bump to run the sales point, nobody would agree to that. You would have said 3.5% now, go to my neighbor. I mean, the insurance people already have the commissions built in. We said, you don't even need it. And 3.5% is not enough. It's not enough to run it. And they're short of money, even at that. And then when we were and they said, then we can kick off plans we don't like. We said, well, don't do that. I mean, that's crazy. But they, whenever something, I'll just give you a lesson. If ever you have a party in control and it jams something through with nobody on the other side agreeing, frankly, whichever party it is, it's not going to go well. And so they were so proud, and just they wouldn't take amendments on the floor. We could not discuss this on the floor in 13 and 14. No bill was germane. We had no hearings. We had bills to fix it, and we worked on it. And they were like, oh no. And now it's become toxic, and it's like a religion for those who passed it, and it's just been like a third rail for those who didn't. And what's happening now is because of all the bad design and all the ill will, you all are getting and fabric and it's still so toxic that the governor didn't tell the Republicans there in the House and didn't, I don't know if the Democrats here in the Senate knew it, but I didn't know. I didn't know Blue Cross was there at this point. I didn't know the paper. We should have a special session in July to get this squared away when there was time to go like, hey, let's fix all the rate setting. And so, if you get, something goes bad, you kind of want to hide from this, and it's only have come out now, just in the last few weeks, because the rates came out. That's how we found out.
sure. You've already covered a lot of it, but the premium increase is huge. And,
Well, tell us your specifics.
okay, my husband and I own a small business,
Yeah.
just the two of us on the insurance. We paid about $15,000 in premiums this last year for two individual plans, each have $500 deductible. But my bigger concern right now is the lack of insurance policies that are gonna be available to me next week, because I was on those products. The government says I have to have this or pay a penalty, but there's only 7,000, 10,000 policies available for 103,000 people. It's not gonna work.
Right, or you get the other default setting, which is Medica,
Well, no, I'm putting that in there.
Oh, no, there's enough to go around. If you don't mind a lousy plan at extremely high price, you can get one.
Now I feel better.
That's a good process.
No, I mean, I'm 50. And what do you think you're paying next year?
I don't know, because I didn't get premiums from Blue Cross, so I don't know yet. I'm guessing it's gonna be in that $24,000 range.
You made a choice between a Chevy and a Ford, right?
Yeah. You know, some of the things that was touted as being one of the reasons why it's gonna work is because all of the young people who don't need health insurance were going to be buying insurance, and so therefore we would have extra premiums to pay for those that were using it. And that finally we would get everybody on health insurance. And neither one of those come true. We still have people that are not covered.
Minnesota wasn't broke before this all happened. I worked in health insurance for years. I just spent 2 days at continuing ed in health insurance. We had, 5% uninsured prior to Obamacare getting kicked in? We had a plan in place to cover people. We had NIMCHA. It wasn't broken. And then this all comes in, and now 3 years later, well, 6 years, but this is the 3rd year that we're really in trouble. We're looking at this, you're right, you should have had people in the industry giving you advice.
And
6 years ago, shouldn't have these meetings.
as a reformer back then, the peak was 9. It was 5, kind of fit it up. There were at the time I was involved as chairman of the 7. And so,
And what is it now?
4.
I heard 8 today.
Oh, well, whatever, they were bragging about 4.
Okay.
But anyway, so 7, and I said, well, let's focus on the 7 and not wreck everybody else's work.
Right.
And if you're gonna do the MNsure experiment to buy this wonderful Expedia thing, then leave the people who aren't gonna buy individual policies outside of MNsure alone. That was the 4th thing that I begged them to do. I was 0 for 4. And so just on the 7%, let's just use that as a number. 2% didn't want insurance. They were happily self-insured, they were taking their risk, they had enough money, or they just didn't care, or whatever. And half the people could have bought some kind of state plan, medical assistance or Minnesota Care. It would bother you to go down and sign up, which left maybe 2, possibly 3% at the most, in my judgment of time. And over all that 2%, this all has happened. And rates were high, but everybody thought the rate was high 3 years ago, which is saying, and even MSHA, that's the Minnesota Comprehensive Health Association. That's where the people that couldn't get insurance went there. They had to pay 120% of par, with $1,000 deductible and an 80/20. How many of you would like that plan back? And that was supposed to be so horrible for the poor souls who were sick. It worked. Minnesota had it figured out. We were nation leading. You need to go everywhere. You got your doctor. You've known it for 20 years, and you work it out. Anyway, you better.
Okay, so Jerry, Socket, do you want to talk? Okay. Can't read it, great. Cheryl Keith?
Most of what I was gonna cover has already been covered, so I'll just give you some numbers that I always go somewhere in the legislature. One way that hasn't been brought up yet, that there's a drain on our economy beyond the 2% that you just mentioned. Now anyone who is lucky enough to be under the Affordable Care Act, they want to stay there. Meaning, it's November, you want to hire someone to work on your house, you tell people, I can't work until January because I want to I can't pass my AGI limit. So people who are not contributing to the economy because they're afraid they'll pass their AGI physicals at the same time, had exactly the same test, except he had the extra men, PSA and things like that. My bill was $350, his bill was $50. So that's what we have from mail in this county as a result of competition. Another way this is all affecting us, so looking at the demographics, my husband's fairly healthy, he's got that back, I injured my husband this year. He had one cardiac scare that turned out to be worse, so he was in the emergency room. We spent this year 20% of our ACI on work. And he's working professionally with another retired thing. So, you know, I sympathize with the woman in orange, but I'm looking at, if I keep draining my finances, my investments the way I am now, I'll be a burden to my children in the future because they need to spend my money to help. And that's money that's not going into the economy. Those are my points.
Okay, Lori Bennett, is that right? Felton?
Hi. I drove an hour to get here because this is a Steele County thing. I'm from Olmsted County. I live this far from Mother Mail. So we have, well, not really, because our premium, if I live north of Bemidji, my premiums can cut in half. So I don't know if it's so good that I live that close. My husband and I are farmers. This is my husband Clifton right here. We were paying, right now we're paying about $1,000 a month, okay? We have Blue Cross. December 31st, we have no more insurance. I've checked out Minsure, and as far as I can find out, the cheapest, well, we have a $5,000 deductible each. The cheapest policy that I can get right now is $26,000 with a $13,700 deductible per person. So we're going to spend per person. That's for $26,000 premium a year. So that means that even though he and I are full-time farmers, I would have to go to work. I'm over 50. You never asked a lady her age or her weight, but I'm going to tell you, I'm over 50. And for me to go out and look for, I've been looking for 2 months for a job. Who's going to hire me with virtually all this farm experience that I have? You know, I've been keeping books. I'm a veterinarian. I mean, I have all these experiences, but they're not going to hire me. And so I'm an entry-level employee at $12 an hour to get benefits. And so if they take money out of my $12 an hour, that brings me down to $9, and then you take taxes out of that, I'm on 40 hours a week for $5 an hour. And then I have to hire somebody to come and take my place on the farm for $12 an hour. The math doesn't work. You know, and because we farm, I can't charge more for my corn or my soybeans or my cattle to make up for the increase in health benefits. I can't do that. Because the Chicago Board of Trade and the Minneapolis Mercantile, they set my prices. There's nothing, my hands are tied, we can't do anything. So for us to go without insurance, because by the time we pay both deductibles, if something catastrophic happens, by the time we pay both deductibles plus our premium, we're over $50,000 before insurance even kicks in. We've been married for how many years? A long time. Like 35 years. I think about 70 if you add them together. So we've been married for 35 years and never once have we paid $13,700 ever. So, but because we farm, our children farm, do we risk losing everything we've ever worked for in the future of our children to not have insurance to pay that little fine? Or what do we do? I mean, it's bigger than what a lot of people think it is. And when farmers make money, we spend it locally. People like our realtors and our builders and, you know, all these other small businesses, they, in our schools and our churches, I'm going to be honest with you, I donate more when we make money. Our churches do better when we make money. Not going to lie about that. Thank you. You know, so do we go without? And I just told Clifton, I said, there's a couple ways we can get around this. Number one, we can rely on our auto insurance and hope we're in a car accident, because then our auto insurance will pick it up, okay? Because $20,000 a piece, and hopefully it's not our fault, and the other auto driver will pay for it. Farm
Not a
liability,
very good strategy.
no. Liability on the farm, household liability doesn't cover you. We'd have to get hurt on somebody else's place. Or
That's not a good idea.
we could get divorced. Because if we get divorced and live together and still pay taxes together, pay taxes,
Yeah.
I can take a measly wage off the farm and have him covered. Do you want to get divorced to save $50,000 a year? Or is this what you call federally assisted suicide? Because if I get pancreatic cancer, I am not selling all of our farms to the Mayo Clinic to save money.
No, something that's come a group might help with a small group, and maybe later the agent can help people. The small groups are really more stable than this niche because of the disparate population. And I was talking to one of my agent friends about this town, and if you're a you can actually have a group of two and get a better base rate than what you're going to experience on this. Or have your guys look into that in your family. We have to be a wage guy, and you have an opinion, but there's somewhere to go with that perhaps, because the group is still not as death spiral as
We're doing not small groups.
Well, I see.
We're talking small businesses.
What are the small groups like now?
I used to have 15 on the books.
Yeah.
I have 0.
Really?
And you're not wrong in that there is some more stability there,
Yeah.
Senator, but this cost differential, the lady used the example here, 10 minutes urgent care to get a bill for an infection, Owatonna, Minnesota, Mayo Health System, $450.
Yeah.
6 months later, Park Rapids, Minnesota, still no competition, same kind of visit, need a bill for an infection, $165. One of two things is true. Mayo is gouging, or Park Rapids is going to go out of business. I think you better be concerned about 75% of the state going out of business if that's the case. So we have to wrestle with this cost, and I came here tonight reluctantly because I don't know that there's a way out of this. But I want a solution for right now because it is wrecking the finances of every one of these individuals in the room. Here's the solution for it. You guys have some coverage through your legislature, through the state. It's a group. The groups, these big groups, they're stable, right? Tell you what, take the $300 million, throw it in the kitty. Let all of us sign up for your group, and we'll pay 9% of our income, and take that deductible, whatever it is that you have, or give us a choice between the county employee plan, the city employee plan, the school district plan, the state plan. It's only 5% of the population. It can't possibly break you. Because, tell you what, like some people say, we're not sicker. Our bills aren't bigger. That's not the facts. The facts are, we have a provider that for whatever reason, and if they need the money, I'm all ears, the $450, $165. Another example of programming a cochlear implant, $500. And you talk about competition and negotiating power. Blue Cross insures half the people in the state. Mayo gives them a 10% discount. $500 turns into $450 for this little device in my wife's head to make her hear. Health East, $365. The Mennonites that have no market penetration in this, for a health sharing organization, negotiate that down to $135. So the problem isn't about competition, and we got to do this, we got to do that. Our costs are just too high, and that's what's driving these premium costs. So the quick fix to fix our problems, we'll take your plan, Senator. We'll pay 9% of our income. If your income's $300, who wouldn't pay their 9% of their income? The average income in this community, household income is $65,000. You wanted numbers? Here's my numbers. If I go to the cheapest plan in Blue Cross Blue Shield for next year, for my wife and I, it's $30,000 premium. It's $13,000 deductible. So half my income if I'm average, half my income if I'm sick, if I'm well. A tax credit? Please. Don't waste your breath up there with that. It's worthless. It's not going to fix the problem.
Yeah, nobody thought it would fix it.
Don't even waste the breath. Special session, they're wasting their money. Give it to us to pay our medical costs. the special session, and get it as a tax credit.
Isn't there a proposal,
Well, it's meant to be a
talked
first.
about for a 10%, let's see, it says here, during special session, one possibility is to implement, a cost reduction into the market so that people are not paying any more than 10% of their personal income.
That was the proposal from the DFL.
Okay, is that something that you
Yeah.
would support? I mean, he was just talking about
Well-
that, that's something that you would support?
I'm trying to find a way to, the first thing, if a person's drowning, you gotta help them not drown.
Mm-hmm.
You're gonna drown, and so are you, and so are those people who've spoken up, and this is a really hard thing. My entire professional career and 17 years in my part-time job, trying to be pushing people, talking about Mayo. At least the good news is people finally admit Mayo all the time. You couldn't, it was like, there was a veil. Oh, you're right in the shadow of the mother.
So would you guys, would that be something, like you gentlemen just suggested, that you would be willing to address in a special session? Saying,
That's
hey, in the individual market, we are gonna say, people don't have, they can't pay any more than 10%.
Well, I'll just say my personal thing, and they can respond to it, because if I was a king, I wrote in my editorial with my friend Worthington, that we should have a special session starting November 9th, not before the election, first thing after that. And so let's get hearings going now, because we have to know what can be done. But if I was the king, if I had a gavel, I don't have a gavel, I had 2 years I was chairman. If I had that gavel again, I would have hearings already. And I would have been pushing to have my federal representatives, Klobuchar, Franken, Hammer, Collins, all 10 of them go to the Secretary Burwell and say, sign this waiver paper so we can start over. How do we get Blue Cross back?
I mean, I'm talking about pretty immediate, I mean, of course people.
No, that was my goal was immediate. My goal was to get Blue Cross back in and find a way to, the reinsurance, this high cost that these people that fell into this novel pool is what's killing you all. And until you fix that, you haven't solved the issue. And so then, if you could find a way to find that several $100 million and have people rebid, I mean, it was, you know, Star Wars, the Death Star, that little bomb that hit the exhaust port. That's how hard it was what I was trying to do.
Right, because you've been dickering back and forth, like.
We're not even dickering here, I'm just telling you what's on the table. So there's this proposal, to subsidize, you don't pay more than a certain amount, 1-year plan. The governor just today announced a 1-year plan to reduce your whole premium by 25%. So it goes from 26 down to, you knock off 7,000 off of that, which is a bit in the ocean for a lot of them. But that's the proposal the governor has. In a very heated press conference yesterday, Speaker Dowd said, what about the cap? What about the access? And we have to talk about that too. And so, is it Paul?
What about
You
mail?
know how hard this is.
I didn't take my full 3 minutes. What about mail? So I came from an area
Yeah.
where you needed a lab, you had 5 labs to choose from. You needed a hospital, you had 3 hospitals to choose from.
Yeah.
Here we have only mail. So what's driving our cost? I mean, is it within the legislator's power to take a look at why mail is gouging?
They're a private corporation. If there were more males around, you could go across the street to the clinic, to a hospital that you go to. Anyway, so somebody that, yeah, sure.
I have to give you a disclaimer before I start to speak. You alluded to this already a little bit, Senator Abeler. I'm on the MCHR board.
Oh.
And I've been on the MCHR board for about 18 years. And I think people here, we're really confused about how this problem really came
Go ahead.
to be. And I'm not here to defend Mayo. I'm really not. I wouldn't do that anyway. But I would tell you that Mayo they don't own the Twin Cities, and this problem is huge in the Twin Cities too. It's worse here, but it's huge there, so it's not just the Mayo. It really, I'll try and do this briefly. Prior to the Obamacare, the Affordable Care Act, and I'm not here to bash it, okay? What you had is the Minnesota Comprehensive Health Association that was formed because individual health insurance, which most of you are buying, the insurance companies have the ability to ask you, how healthy are you when you applied for coverage? And if you told them that you weren't healthy, they said, we don't wish to insure you. And I know many of you think that was really bad, okay? okay, I get that, but hear me out. Those people, the reason individual insurance rates stayed as low as it did is because the insurance industry protected it against people being able to buy it when they just needed it. They were able to say, you can't buy auto insurance right after you have fender bender. You have to buy it when you don't need it before it happens. And I'm not here even to defend the insurance industry. I'm just telling you how it works. AMCHA existed and was created for that very purpose because they said, you know what, these people that the insurance companies are going to say, you can't have insurance with us, you need to have a home for them. So AMCHA was created for that. And those people all have the right to go to AMCHA and buy health insurance from AMCHA at a price that was somewhere between 100% of the market and 125% of the average market. And it varies from year to year, okay? I will tell you, because I know the numbers, in AMCHA, toward the end of its pool, AMCHA was taking in from the people that insured about $100 million a year in premium and paying out $260 million a year in claims, okay? But that was by design. We knew that the people that were coming there were not healthy. But here's where it really changed. That $160 million was then funded by an assessment across the whole insurance industry. Now, I won't tell you that that assessment was right because it would only assess to the people who actually bought insurance. The people, the employers that self-insured, they got a free ride on that whole deal and never had to support any of that. And I would give you my editorial opinion that that was wrong. It should have never happened that way, but that's the way it was. When you went to Obamacare, or the Affordable Care Act, and I don't mean to use that word to disparage it, what they did is all those people that were in the Minnesota Comprehensive Health Association that were costing $260 million a year versus $100 million a year of premium, all of them went into the individual insurance pool. And now the whole, and this is not to disparage AMCHA people either, but that whole necessity to subsidize that for all those sick people, instead of being borne by the whole insurance industry, it's now yours as individual policyholders to bear. That, what I just described right there, is why Blue Cross, and you may not want to believe it, but I'm telling you it's true, they have lost their shirts on this program. The numbers are awful, and that's why they got out. And that's why Medica is limiting how many people they're going to take. Preferred One made a real mistake, quite honestly, when they priced the plan a few years ago. And to talk about a loss, you can believe me, it was huge. My point is this: the problem you have with affordability as an individual trying to buy insurance is because you took the population, you've now eliminated the insurance company's ability to say, if you're not healthy, we don't wish to insure you. Okay, maybe we see that as a societal good. But the funding mechanism to spread that over is way too small. That is the fundamental problem. Mayo's confounding it, perhaps, because they are expensive. But again, this problem is huge up in the Twin Cities as well. And I think those of you who are suffering underneath this, and boy, I believe it, Jar. I get it, believe me, I know this stuff. I would hate to be having to buy individual health insurance myself. But that's why the problem was created.
So the answer then is to find a solution that expands those costs across a larger pool.
You know what I would tell you, and I think Senator Abeler alluded to it, we had a great system. We were the model for the nation. Now, we had a flaw in it, and it needed to be improved, and I think the Senator will agree with me. We needed the funding base for that to be the entire market, including the large employers, and not just the people who bought insurance, because that left the burden to the individuals and the people who were small employers who were buying insurance. And it should have been a societal good that we funded across the whole, the self-insured employers as well.
How was it decided that it was only that small? How did that happen?
Well, you've got to remember, AMCHA was created back in 1976. And in 1976, we had about this many employers that self-insured. In 2016, we got this many employers that are self-insured. So at the time they created it, the problem was not nearly that severe. But it got worse over time, and there was no willingness to fix the funding mechanism for AMCHA. But I would tell you, if we could return to what we had prior to the Affordable Care Act and change the funding mechanism, we were the model for the nation.
Do it.
Did
And the
MSHA
employer,
reinsure?
Excuse me?
Did MSHA reinsure people?
No, what MSHA did is they just assessed the insurance industry for their losses.
so they had a former reinsurance that was the assessment, so they paid their $100 and then the excess costs were borne by, actually you all, anyway.
Right.
So self-insured plans are exempt from anything the state can do. We can't tell them to print on their card, we're a self-insured plan. I tried that actually, so the clinic said, no, you're self-insured and you have different treatment, of your table. And that's where it went.
Okay, so we have about 6 more people, we need to get through them, so the next one
Thank
is Rob Panuska. And
I kind of came in here loaded for bear, but I can't believe it. My wife and I farm as well. We're at least blessed enough that we have a business that we can at least deduct the costs. That was always my beef before, when we didn't have enough income to actually deduct the cost, and they wouldn't let us, as an individual, deduct it like whole mortgage interest rate, interest. That seems like a reasonable way. Anyway, my insurance premium is with Medica, male bronze. We both have $6,500 deductible this year. My increase is 76%, not 67. It's going from 908 to 1602. Now that was what I got on the phone today from Medica. I have not received the letter yet, but I called and asked about it. And that's estimated, because they don't have it set yet. I don't know what they're waiting for. At any rate, $694 a month. That's just basically. Again, I can't even fathom $26,000, $30,000. It's just completely incomprehensible. And thank you for your comments about mail. And thank you for the background on all of this. Let's just back up the truck.
Right.
Literally. And why can't we get these feds that we have elected to give us the ability to back out and go back to what we had? I mean, come on, people. We need to go and pound on these flippin' national representatives. I mean, they have got to back up the truck here. And we have the solution. And I agree with you 100%. Everybody needs to cooperate and fund the folks that are having the high medical bills.
yeah.
I mean, you've gotta help. We're all in this together. And so why can't we just back it up to what was working?
I'm sorry. We had Civil War that says we are part of a country. Minnesota is part of the rest of the nation. And what we're talking about here, yes, Minnesota had a good program. Other states had nothing. And the Affordable Care Act covers the nation, and we are part of that nation.
Okay, let's move on to Sylvia Archer. For starters, I just want to say that we are the only developed country in this entire world where people are adversely affected by medical costs. We're the only one. If you want to read it, watch a documentary that's an eye-opener. It was a PBS documentary. It's available at the library. It's called Sick Around the World. The guy went and interviewed people all over the world. He interviewed people who received medical care. He interviewed people who were the providers. He interviewed people who were in part of the government. And everybody was happy with their system. And the last thing he asked everybody was, do you know anybody who has, faced bankruptcy or has high medical costs and has cut them back? And they were just astonished that he even asked the question. They said, one guy said, people wouldn't put up with that. So how do we fix it? We need to look at whatever other countries are doing. We're the only developed country that is like this. I wound up in the hospital in an undeveloped country in Central America for a month, and I was worried about how to pay the bills. This was in Nicaragua. It's a very poor country. And it was not, I mean, it wasn't, you know, the kind of care we have here. We have private rooms and TV and blah, blah, blah. I was in a ward with 15 other women, but they provided good care. Social worker came in, she said, you don't know what to pay. I didn't have to pay them anything. She said, if you want, send us some money so we can pay it and just pay it forward. You know, there's something wrong, there's something broke about our entire system. And I'm sorry, but I'm one of those people who benefit from Obamacare, from the Affordable Care Act, because prior to, this system was not working for me and for a lot of other people. I was one of those people who was uninsured. I knew a lot of people who were uninsured to get any kind of medical care at all, because I had I had more than one pre-existing condition. I was reminded of that a lot. I was afraid to leave a job that I absolutely hated because I couldn't get care. And I wound up having to drive all the way to Dodge Center to get medical care and I cried when they told me that it was only $10 to pay because they volunteered their time. I'm sorry, but it did not work before. It is broken. We need to do something different. We need to do something about the medical costs. We need to do something about the greedy insurance companies. We need to fix this. And I like this idea of the 10%. If everybody paid 10%, we'd have it covered. We'd have everybody covered.
Okay. Helen, do you want to say
Let me just say one thing about, one of the problems that we were trying to address in our reform efforts was the portability. So you wouldn't be trapped in a job. There's a lot of people in that situation where they were a single person and they didn't have other resources of a spouse they could pick and choose from. So if you've, I told you came to listen, I think we're all learning something. You're learning how complex this is. You've heard from a couple of people who have dedicated a lot of years of their lives. Yeah, we're not further. The dedicated corner of the lives people are at. Anyway, but it's really, really hard. But then you have, it wasn't designed to have you all wind up in a room like this talking about how you're about to be around.
Okay, Helen, go ahead.
Okay, I'm Helen from Hamilton. We're not on MNsure, but I'm kind of concerned because by 2018 we could very well be on MNsure because I'm getting laid off next year, and that's where we have our coverage through. And our son right now, I'm not sure if he's going to have to apply for 2017, but I ran numbers today for 2017, and his premium, age 34, would run him anywhere from $565 to $795 a month. That's just for him. His two daughters, according to MNsure, when you first log in, would be eligible for MA, okay? His maximum out-of-pocket, the actual maximum out-of-pocket would be $13,149 a year. If he brings home $800-900 every 2 weeks, and he's paying $600 to $800 a month for rent, what are they going to eat on? Okay, there's no money left over if you got to pay $600 to $800 a month for insurance. Okay, I just wanted to comment on that because have you guys looked at by chance what's the percentage of bankruptcies that we file? Okay, because I know for a fact that there's some people that are filing bankruptcies because of health care right now.
You know, one of the reasons that this got done was because of medical bankruptcy. I'm just saying that's irony.
But,
Irony is bad.
okay, the other thing, I've got a cousin Shakti, who today she got her notification, her premium is going to jump up to $1,803 a month, that's just hers. With an out-of-pocket max of $14,300, and after that, she's still liable for 50%. I've got another cousin down in Oklahoma who's going from $1,250 to $2,100 in January. That's just one person. And her deductible is going from $4,500 to $10,000. And she's about our age. And as far as the bad insurance companies, I happen to work for one of them. I worked with small employer groups for years when Minnesota Care became available back in the early 90s. And Minnesota Care worked. I mean, there were some bad things for it, in it, but it worked. People had to contribute something, but they got something in return for it. And when all of this started coming about, like I said, I worked with the small employer plans for quite a while. And part of the problem is out of the counts in Minnesota, you probably had 25% of the people that weren't insured because they were young, healthy, and they didn't want to pay for it. I'll wait and get it when I need it. Or when I'm 30 and I'm having kids, okay? So they didn't pay for it. You got another 25% that have coverage through their employers, maybe 30%, whatever. You got another 25%, and the numbers are probably just approximate, but who are truly uninsured and need the help, okay? They can't afford it. Their jobs are such that they don't qualify for assistance. They don't know they're eligible, okay? And then you got 25% probably that are illegal, and we're paying for them. They're using our ERs, and we're paying for that. And that's one of the reasons the healthcare costs are going up. And as far as living down here, we live in Faribault, we've got a Alina Clinic, we've got the Mayo Clinic, and now we have an Alina Hospital. Some of our docs can't do their business at the hospital because it's Alina. I've heard, and I don't know if it's true, that there's people that have gone into ER and they're told, well, you should be put in the hospital, but we can't take you right now. You need to go to Owatonna or you need to go to Northfield. Well, why is that? Well, we have a shortage of nurses, so we can't fill up more rooms than what we have people to care for.
One more minute, Helen.
Okay. A month ago, I was sick, bronchitis, whatever. I went to go to the Express Care mails. They're closed. I called the clinic. Hey, I just came from Express Care. It's closed. Why? Oh, well, the doc that worked there said we didn't have a replacement. Well, my regular doctor, who replaced my 30-year doctor 2 years ago, he quit in September. Mayo doesn't seem to keep docs anymore. The gal told me, well, if you really think you need to see a doctor, you should go down to urgent care here in Owatonna or go to ER. So we're back to pushing people to ER. That's bad, you know? And I'm afraid of what's going to happen next year when a lot more of the ACAs are starting. Because we also have, and I don't think the state should allow this, a health carrier to sell insurance to an employer group or individual down here, southern Minnesota, that does not include Mayo as part of the network. Because we have employer groups down here who their people live here and they can't go to Mayo. And that's pretty much all we have in southern Minnesota.
Okay, do you want to respond to that, or we'll keep going? Okay.
Comment? Maybe one more comment?
Yeah, go ahead.
I think you guys in St. Paul, you need to go back to the drawing board and rethink giving Mayo $500 million billion in 2014 of our money. That just ticks me off, because Mayo does not like it.
Oh, yeah. Hi, I actually don't have. Sam, thank you, and your colleague, you, also, in the Senate, so, we have that. Sure. I want to thank our representative, Representative Daniels, and Representative Peterson for being here, and we'll take the whole of that. Thank you all. Also, I would have to bring a message from your colleague, Senator Jensen. She's not able to be here tonight. She also has received a lot of questions, calls, concerns about this issue, and she did put together some of the frequently asked and unpleasant questions and ideas and feedback and solutions, many of which that we've talked about. In particular, I would echo the room that you truly are one of the most passionate, although you probably would be. Really, really passionate farmer who works for bipartisan solutions. Thank you.
Okay. Jeff, do you want to make a comment?
Celia made the point that in the United States, as far as we're a developed nation in the world, we don't have a single payer health plan. Other nations have it and it works. So why can't we learn from other nations? And right now, the majority of people in this room are being hurt because they're self-employed, they're farmers, they're small businesses. And this is wrong. You get crushed. Something has to be done. Luckily, I got to work union for 30 years. I have a retirement plan. I have health coverage. I'm on Medicare now. I pay my supplement. I haven't made it. I had the best. I wish you could all have that too. What happened? What really happened? This country can do better as a nation. Jeff said, we're one nation. We're not 50 separate states. We're one nation. We should be able to have one universal plan to fit everybody. Affordable Care Act is try to take care of people that are being kicked off. They couldn't get insurance from that. It was a good idea. It's a good start. People think you should throw it out and start over. What are you going to start over with? We can make it better, can't we? Let's work together. Here's Jeremy Miller here, State Senate Representative from Owatonna, State Representative representing Illinois. He's a Republican. He talks about working bipartisan, working together. He's part of the Purple Caucus, combination of Democrats and Republicans actually working together instead of butting heads all the time. And that's what we're frustrated to me, and I think a lot of others here. Just a fighting head nothing. And again, political stance, we have political policy. We're tired of it. We're tired of it. That's my comment.
Okay.
I'll see you one.
Real quick, Ellen, when you guys have your special session, I think you guys need to invite our two federal senators, and I think you need to invite our representatives from the 8 different districts, because we're who they are supposed to be representing, and they need to hear some of this. Because you can't get Amy or Al like you can you guys. I've tried writing them, and they don't respond. I've tried, huh? That doesn't talk about what I'm complaining about, but they need to hear some of this too, and, they got their heads in the sand, all of them.
Well, that's just to make you feel better about one thing tonight. Minnesota has more representatives and senators than a lot of states, which gives you this. So that's outstanding. You have some very interested folks.
Okay, so we have one more to go, and that is from me, reading the scenario of a Minnesota worker. His 2016 premium for health insurance through Blue Cross was $785 a month, with an $8,500 deductible, which January first, the premium increases 49% to a new total of $11.69 a month. So for 2017, if he works half as much and cuts his income down by $30,000, he will qualify for free state health insurance. He'll pay less in taxes, federal and state, and would not have to pay anything for planned elective surgery for his wife. He would save $3,000 and have more time off. So he's not ready to retire, but he doesn't feel he can work full-time and afford health insurance and pass up this deal. So he's wondering why work.
Yeah.
Yep, yeah, really.
You know, the tragedy of all this is that you couldn't have focused a laser better on your slice of Minnesota. You're you're courageous, you farm in good and bad times, you provide services to the people in good and bad times. You choose to live here with, the great life you have in this place, but challenges
Okay, so with that, I'm going to thank you all for coming tonight. I think most of us agree in the room, health insurance right now in Minnesota is a train wreck. And I want to encourage you not to give up, to keep talking, keep contacting your representatives, your legislators, make sure that they get the job done. So we have the room till 8:30. I encourage you to talk.
Let me ask you one more thing.
Okay.
So I think you've all been enlightened or discouraged either way. Let me give you the lay of the land that is, and then part of what I wanted to hear was some thoughts about solutions, and we've talked a lot about problems, but now we have to go figure something out in a very polarized world before the election, and into a pretty much in the legislature, people all run to work together, but at the end, whoever in charge of the one body runs that way. And if you're the minority of that body, you don't get a lot, even if you're really knowledgeable. If you're the majority, if you don't know a lot, you get to be in charge. Like, it's amazing. And it's in both sides, so it's like the worst of all. But so here you have all this problem, which you understand. You have some neighbors who are in the suckiest spot and didn't realize you were obviously not alone. But so you have a governor, and so if you want to repeal Minshire, let's just say that's an idea, the governor is never going to get rid of Minshire. There's 2 more years, it's not going away. Different well-intended people disagree on what they're doing. It doesn't work very well, it costs a lot of money to make it be there, but it's there. And I was one that thought we should have a Minnesota version. I think my colleagues may disagree about that. We're not going to spend time about that, but I'm just telling you, if that's your solution, the governor is not going for that. So whatever happens, if you get 2 Republican bodies, the governor is not getting rid of it. He's not getting rid of Obamacare and Affordable Care Act. And so, but you have all these issues, and then you have a limited number of HMOs that serve the state. And how do we get the access to your clinic back? How do we set up, we have to set up another answer, that's part of that, and decide how to fund it. But how do we, the perennial question is, how do we get more clinicians that want to come out to live here and enjoy the things you like about being out here? That's a perennial problem. We have some scholarships we give them. But so, as you ruminate about that, you can work your locals here, or I can, you can try to get hold of me if you like, or send the governor your thoughts. But this is a real problem. It's not a drill. And the realities of what you wish you could do are very constrained, both because of time and because of the political environment and because of the money. I want to remind the fans of more help from the Fed. We're already $18 trillion in debt. And we're in the range of $600 billion a year in mounting with the deficit now, every single year. And at some point, that's been turning to real money. And so, and the subsidies that are subsidizing the Minshire lucky ones are printed on paper no better than this. And we have China, Russia, we're in debt to so many countries. You wouldn't like to rebuild it, so make it even worse. So with all those realities, putting aside partisan interests, it behooves us to really have a dialogue. But it's only been one side. And that's my frustration. And here we have now the results that some of us predicted. And you all are gonna suffer. So, and looking forward, where do we go? And that's what the gentlemen here are all interested in hearing from you. And
So are you saying that we're gonna litigate this again next year? Because it's in place for 2 years. We'll get a 1-year fix. Next fall, we'll be doing the
do it
same
again.
thing.
Yeah, well, let me cover that. So, there are 2 proposals on the table from the Senate DFL and House DFL, and they resemble similar. Actually, the Senate DFL did not have them. The governor proposed this tax credit of 25% of what you're paying now out of the non-insured people.
And so credit's gonna be funded from where?
The
Property taxes?
No, cash.
General income
Cash
taxes,
from
general fund?
surplus.
Surplus.
And frankly, I don't mind, of all people who deserve from that surplus, if you all move up. So I'm not, have no problem with that idea whatsoever. But so is it gonna be enough value to you to make it worthwhile? Is there a better way to spend $300 million in the short term to rescue you all? That's the, you have the expediency, emergency part. You have what's practical, you know, what resources are available. How do we draw 6 more insurance companies in Minnesota and 5,000 more clinicians? Well, that's not gonna happen. So, anyway, and so I want to hear from my experts. Rescue us.
So we had a bipartisan solution recently between Representative Petersburg and Senator Jasinski in South Country Health Alliance, a government conglomerate that do medical assistance coverage. The structure's in place. It's so affordable. Let us sign up for it. We'll pay 10% of our income. The structure's there. We can be there by the first. It solves our problem here. We're unique. I know. Or give me the freedom if I want to drive 4.5 hours to Park Rapids. You know, and I'm not, you know, I'm almost at the point where saying single payer, go ahead, lay it on me. Lay it on me. But folks, you got to understand what single payer means. The rest of the world, my wife hears, she's deaf, she hears for both sides because we're American. In Canada, she'd get one because that's good enough. Right. And she wouldn't get to pick her surgeon.
Right.
She'd take whatever surgeon was on duty that day, and he'd put in whatever's on the shelf that day. That's single payer. That's not what we need in America. And I don't know whether government, what we are going to end up with is a bifurcated system of the haves and have-nots. Mayo Clinic Destination Medical Center is not going to be for us, but it's built with our tax dollars. We have the structures in place to give us a fix. Now, you guys do need to get up there and work together. You know, I don't know what you have to give them to say, yeah, you can use South Country Health Alliance for your people in southern Minnesota. But we need the help now. A year from now, talking about it for another year, 25% tax credit, it's not bringing me back on the roll. It's not. And I don't think it's bringing any of these people back on the roll.
Well, that's helpful to hear. Just so you know, allowing, I'm a big fan of county-based person. And South Country is how many counties are in South Country?
Well, my concern is, you know, if their numbers are really true.
Yeah, but so
throw out Blue Cross.
the rates they pay are Medicaid rates, which are really going to get you rationing. So you have to find a way to get market rates to the clinic so they can actually choose to want to see you. But South Country, those kind of things could be the vehicle to deliver the services you want at a much more affordable rate. And that way, the nice thing about South Country is it's boards, it's commissioners, it's transparent. You know where your $26,000 is going, and it wouldn't be $26,000, it'd be 18 or something, and because there'd be this partnership then. And so,
Well, but I think it should be 9% of the income, not 18,000 or 25,000. I mean, they're the same. And are you telling us the medical assistance people have ration care?
yeah.
Well,
Well, you get a dentist on medical assistance. You can't do it. Yeah, no, and so, right, and just, you know, there's a thing, welcome to the complexity of health reform. There's a thing called Rule 101, that a doctor or dentist who takes a state employee has to accept 10% of medical assistance. When you get much past 10% in a neighborhood, now you're gonna have to get in line, and they don't really have to go beyond 10%, and many times it's below their cost. And so you can't make corn and sell it for $1 less for very long. And stay in business. That's the problem with all these ideas about expanding the Minnesota care thing in particular. But the infrastructure and the collegiality that South Country has developed with the providers and the payers is a very positive thing, which is a whole step back into a distant time, which has some merit, I like.
And we're only 5% of the population, what could we possibly do? And I've compromised, I'm down to taking medical assistance now. I wanted to have your plan earlier tonight.
I just have a question, and I've heard the proposal of a 25% credit, and then a couple nights ago, I heard Senator Dahl say that what they want to do is come up with a rebate check, anything over 10% of your income that you were paying in for health insurance, you'd get a rebate check for. It's about 200 million, or is it about, when you say about $250 million, do we have any idea what that is? As we throw this about, do we have a, because when somebody says about $200 million, they're just pulling a number out of the air.
Well, let me explain how numbers work. Well, it's how you design it. And I was on NPR pushing 3 weeks ago, 4 weeks. I said, Senator Sharon, why don't you have your, you can have a hearing. Let's get talking. Like, this is actually a hearing. This is what we do in hearings, we listen to people, we learn something like, oh, that's a bad idea. Let's abandon that idea. And so this 25% thing, which sounded kind of good to me coming down, I see there's some real gaps in it from your point. But if the choice is 25% or nothing, like you want the 25%. But is there a better way?
But what's the cost of that 25%?
But so in terms of the mechanism, like the timing of it, where you're gonna draw the line, is there, is it 25% everybody? If you're, you know, a millionaire, if you make more than $1 million, you still get the 25%. And you decide to go to an index of your income or not. And then, well, no, those are rhetorical. So however you design it, you can design a $300 million plan for a tax credit, or a $100 million plan for how you scale it.
Is this the first guy that fills out the paperwork?
No. We have to, they do something called a fiscal. And once you design a plan, then revenue says, well, we're expecting 103,000 people.
But to answer my question, we don't yet know what that would cost if we were to say we're only gonna do it 10%, nobody sat down and looked at the money that's being spent by, I mean, we could do some quick math in the room, because everybody brought their numbers.
Yeah.
But nobody sat down to figure out statewide what that would cost, even
About
though.
100,000 people that are in your business.
Yep.
And so you take whatever amount you're gonna give them, so if you give everybody $7,000 times 100,000, what's that, 70 million?
So would it only be for the people uninsured? Or
It'd
would
be
it
the people that are not uninsured. The people uninsured are already getting it.
No, they're not.
No, they're not. Well, no, the ones that are in the income, no, you can buy from insured, but the ones, there's people who get subsidies. So the people who don't get a subsidy.
So,
a lot of them insured,
but that's
you
what.
have no subsidy, you would get this.
So if you say
to an agent?
our insurance shouldn't cost more than 10% of our income, which I think is a
That's
noble.
hypothesis that you can posit.
Okay, so, and there was a lot of discussion about that in another town hall I was at, and so my question is, that's being talked about, has anybody figured out what the average income is and what the average payment is? Because I'm guessing there's not a lot of millionaires in this room.
Yeah.
Am I correct there?
Yeah.
All right. Yeah, we put it all together, we might be able to.
Let's do a little math on Steele County. You got 60,000 average. Okay, most people in the room, family of 4, are looking at somewhere around $40,000 in premiums and.
That's max out of pocket, sure, or deductible.
Okay, so, I mean, they're looking at half their income. Now, if they make $60,000 as a family, they would get a subsidy from the state. But the subsidy cuts off at 92.2. Rates went up 60% this year, and the subsidy cap, or the income limitations, went from 97,000 to 97.2. So if you make 97,201, you still be on the hook for roughly $35,000.
It's 30% of your income.
30% of your income, just for healthcare. Now, and then you take,
Or 50 is something.
yeah, and it could be more.
Well, let me just help you with the math question. So let's say you make $6,000 and you want, and the hypothesis is 10% down. So you're gonna pay $6,000 for your family of four, which probably has in 2013, it probably cost $15,000 or $10,000 for a family of four. $9,000 or $10,000, so maybe it's 12 or 13 with inflation. So now you gotta find a way to make up $6,000, $8,000 times all the people, that somebody else is gonna pay. And that's the challenge. So now how much money is that? And so you pay income tax, and after a while, there's nobody left to pay all. And then you get back to the questions about the health costs and the Mayo and all those underlying things, but the people who are gonna benefit by the 10% all want that. But when you do the math and look at how much surplus we have, what else then don't you want? You want less schools, you want less law enforcement, and so those are the decisions that these guys and I have to face, and he wants to face. And so, but there is it's a balloon of money, so you can squeeze this one and you can pick this and then it's gonna pop out somewhere else, and after a while, how much do people wanna pay in taxes, and how much can they pay? I'll predict most of you are pretty well at the max that you probably have. And so, I tell you this only so you understand that the answers are really hard, and that well-intended people disagree on polar opposites. But whenever you take a program like this, my personal opinion, and jam it through, and don't listen to people like me, you get this. So make sure everybody listens to each other, and that they work as collaboratively as you, and this doesn't have to happen.
Well, make sure you remember the segment of the economy that's not working now. Yeah.
Oh, it's
They
amazing,
don't
yeah.
wanna work to their capacity because they wanna stay qualified for a while.
No, I got it.
We want those people paid taxes.
I think they made a big mistake. They should have worked a little longer, and they should have gotten at least a little bit of snow. I mean, I think we're about. Actually, it's our time is 8:30. I want to pray God's blessing on all of you. Thank you for your work. Please don't give up. Offer us advice. You are what makes it. You're not going to quit doing that.